Hello and welcome to Attachment Disorder, Trauma and Loss for Early Years and the Foundation Stage. Just getting myself comfortable. Okay, so let's talk about this for a little bit. Before we go on, my name is Andrew Whitehouse, and I've done all kinds of interesting things in my professional career. I would direct you towards having a look at my TEDx, From Disability to Superpowers, which talks about things that people with neurological diversities can do that people without can't do. I also did a Bamford lecture on creating autism-friendly audiology clinics. That's really important because actually, although it's about audiology clinics, you can pretty much adapt the information there to anything, including your early years setting. I deliver short courses at Bishop Grosseteste University and the University of Lincoln. I am a forensic special needs and disability consultant, which means I do expert witness work in courts in cases related to special educational needs and disability, and I do training, observations, and I'm a keynote speaker at multiple conferences. So if you want to be in touch with me, I'll be delighted to hear from you. I always am. My name's Andrew Whitehouse, and you can Facebook me, Andrew Whitehouse at People First Education. You can also Twitter me at Andrew WSEN, Instagram me at Andrew WSEN, and I'm at LinkedIn with a load of letters after my name. You can email me at Andrew at peoplefirsteducation.com, and by level of deduction there, we can work out that actually peoplefirsteducation.com is the website. So you can be in touch with me in multiple ways. And I'd just like to point out that you're in safe hands today. So today we're talking about attachment disorder, and attachment disorder is quite a complex condition, complex disorder in a variety of ways. So I want to talk to you about how it affects young people in early years settings, and I also want to talk about how attachment disorder happens, how they get attachment disorder. Quite simply, attachment disorder is as a result of trauma and loss, pre-birth, post-birth, and early years. So this is interesting in itself, is because this film is being made during the coronavirus lockdown, and I would suggest that if you're watching this after the coronavirus lockdown, that you will be experiencing lots of young people who are suffering quite a bit of trauma and loss post-birth and early years. And if you're, of course, watching this during the coronavirus lockdown, then you'll be experiencing this as something you're looking forward to, or not looking forward to, but in anticipation of some of these problems happening with your young people that you work with. So what is attachment disorder? It's at its very core, it's quite simplistic really, because unlike neurological diversities like autism, ADHD, dyslexia, dyspraxia, which you are quite simply born with, there's no right and wrong about how you get those conditions, how you end up with those conditions and that neurological diversity. With attachment disorder, it's completely different, because in attachment disorder, it is as the result of an action or a happening. So with attachment disorder, what we're looking for is the difference between when things go right and the difference between when things go wrong. And essentially, attachment disorder is the result of when things have gone wrong. So you see the picture on the screen, the person is standing on the banana skin, they fall over, they injure themselves. If they didn't slip on the banana skin, there wouldn't be the injury. And that's attachment disorder. That's not to say that attachment disorder is preventable, but it is, as you know, it can be, but it is as the result of something happening. So when things go right, okay, well, when things go right, what we're talking about is adequate parenting or caregiving. Now, adequate parenting is really the ideal. Nobody is perfect. Nobody parents or caregives or gives good care all the time. And so, but what we're looking at is adequate caregiving and parenting most of the time, or even more than adequately most of the time. And this will have positive impacts on behavior. It will have positive impacts on development. It will have positive impacts on nutrition and health and daily care. Also, from an early years setting point of view, play and learning, safety, connecting, and sleep. And so that's what we're looking for. All those things, those 8 elements of the child's development, being dealt with in an adequate way. So when things go right, securely attached, that means children who've had those 8 areas covered securely will experience good self-esteem. They will feel good about themselves. They'll be confident people. They'll be able to partake in life in an independent and an autonomous way. This is hugely important. So if we instill those skills and that ethos into young people, that's what they'll be able to do. They will be people with resilience. They'll be able to take the hard knocks in life and react accordingly to those things. They'll be able to manage impulsive behaviours. And so what I'm talking about there is in those impulsive behaviours that they may feel, we all feel from time to time, that we're able to control that, we'll be able to manage that, and we maybe be less impulsive even though we feel impulsive. And that would be as a result with these babies and children from secure attachment. They will be better at long-term relationship skills. They will be able to manage their relationships. This is not just life partner relationships, but also relationships with friends and colleagues, that they'll be able to maintain an equilibrium and a balance with those people on a long-term way. Adult authority figure relationship skills. So this is relating to parents, caregivers, professionals, nursery staff, teachers, police, all those people in authority figures, that they'll be able to identify with that because they've been given those secure attachments early on where they learn those skills. Positive social skills, the ability to make friends, to be able to be open and outward in social situations in an appropriate way within the boundaries of social expectations. Trust, intimacy, affection, being able to be trusting, but also be trustworthy, to be able to have intimate relationships with people, show affection with those people, again, within social boundaries. And then finally, a systems belief, a belief in family, a belief in self, and a belief in society, and a trust in that. And that, of course, has massive knock-on effects, positive knock-on effects to later life. When things go right, securely attached children and babies also are able to give empathy. And so the empathy that they'll be able to give out there is they'll be able to understand that, when somebody's feeling pain, discomfort, or upset, that they understand that, and they're able to respond accordingly to that. Compassion, some compassion towards our fellow humans and animals, that we're able to feel that. And then a conscious a conscience. In conscience, what we're talking about there is if we've done something wrong, we know we've done something wrong. Now, that's an interesting one in as much as insecurely attached people, babies and children, grow up into people who find that when they've done something wrong, they find it difficult to appreciate what it is exactly that people are bothered about that they've done wrong. And that's quite a tricky one. And then we get behavioural performance, to be able to behave appropriately. Again, I'm going to use that phrase again, within the social boundaries of society and the setting that you are in at that moment. And of course, academic success to their potential. We're not talking about that securely attached babies and children will all get straight A's, but what we're saying is that they will hit their potential and they will grow up into fulfilled in their academic aspirations. So what about when things go wrong? So some of the things that go wrong are pre-birth stress, and these are the risk hotspots that you might expect. So pre-birth stress would be something like the pregnant mother self-harming, and self-harming obviously is not just physical. We'll look into other areas of self-harming, but the mother self-harming is a obvious risk hotspot. We got domestic violence. If there is violence in the home, you know, babies, unborn babies, they're in there, and as long as they've got full hearing ability, they hear everything. You know, the amniotic fluids transport sound very effectively, and they know when things are not good. They also need to feel safe in there, and so if there's violence going on and they may be getting hurt, this again is a massive potential risk hotspot. Alcohol, drug use and misuse. I have talked about fetal alcohol spectrum disorder in another workshop, and I would urge you to have a little look at that one. Now, alcohol and drug use, obviously the potential major hotspot there is fetal alcohol spectrum disorder or fetal alcohol syndrome, and that is a major hotspot. But actually not everybody who drinks or does drugs during pregnancy will pass on fetal alcohol spectrum disorder to their unborn child. It really is a lottery, and many children do not contract fetal alcohol spectrum disorder. However, it does again mess with the comfort zone and the equilibrium of that pregnancy, and it can cause problems, more psychological problems, a risk hotspot to attachment disorder. Parental illness can be a massive impact on that. Obviously, if the parent is ill, then they can't physically provide as well as they possibly could for that secure attachment and any medical complications in the womb. And I would also add to that medical complications during birth. So that's when some of the risk hotspots when children go wrong. So the other one, which is possibly even more of a hotspot, is some of the post-birth stresses. So we have parental illness. So if the parent is there, a parent or premium caregiver is unable to provide the basic needs of that child, those 8 needs that we went through earlier during post-birth, then that's a difficult one. That's another hotspot. Premature birth, the baby's not ready to come out yet. Premature birth can cause attachment difficulties, not just through the fact that they've been born too early, but the fact that they may find themselves in some kind of intensive care unit, and so that would obviously have a massive effect on that. Medical complications during birth. So if it's been a stressful birth, or maybe, now I don't want to throw everyone into a panic here, but so you know, some of these things go wrong, but they don't always have an effect. But something like a forceps birth can have a massive effect on that. Bereavement, parental death, post-birth. Infant disability. Obviously, the disabilities of the child inhibits the child's ability to do some of the things that they need to be able to do. And then, and then finally, neglect. Neglect is obviously a big one, and I would like to talk to that, talk about that a little bit. I'm finding that in my daily work, that the iPad babysitter, where children, very young children, are given devices to engage with during their early years, that actually this is causing a lot of problems with speech and language difficulties, but it's also presenting in quite a lot of attachment difficulties with very young children. Some of the other things that can go wrong: abuse. Obviously, abuse falls into 3 different headings. So we have emotional abuse, sexual abuse, physical abuse. These are obviously potential hotspots again, and they will cause children to find it difficulty to make those attachments. Home instability. Home instability can fall into a variety of settings. So the instability of the home, in as much as who's living in the home. So you know, if relationships are not going well in the home and people are regularly moving in and out of the home, the fact that the home may not be stable in as much as they don't know how long they're going to be there, which is causing stress and anxieties into parents and caregivers. And home instability, in as much as, you know, it may not be a clean or a healthy environment for them to live in, which then we're looking at poverty, where that has again knock-on effects into food and caregiving, possibly caregiving with the with respect to being able to provide their basic needs that cost money. So I'm not talking about giving love or anything like that. I'm talking about the fact that, you know, poverty can have a knock-on effect of being able to provide basic essentials that cost money. Abandonment. Obviously, child abandonment is going to cause difficulties with attachments. Mental health in caregivers. You know, they may not have the mental capacity to be able to look after that child in the way they could. And then finally here, multiple home school placements in early years. That's when people are constantly moving around. They may be within the care system, they may be within a family unit, that through some kind of work, possibly armed forces or something like that, where they're moving home quite a lot, or you know, or that they may even be you know, families who are property developing and moving home. This all has the potential to have attachment effects on these children, but what it's also, you know, these again, they're not necessarily going to do that if all the other things are in place. So it really is, it can be quite hit and miss, and it's but ultimately we're trying to build resilience in these children. Okay, so what are we looking for? Examples of how children express the effects of an insecure attachment. Now, an insecure attachment can result in an impoverished view of the future, and so I'd like to just move my foot here. I'd like to just talk about. Sorry, excuse me there. But my foot's been tangled up for ages. Impoverished view of the future. So I'd like to talk about the football fan. You know, how they're getting on, and they're rubbish. They're always rubbish. That impoverished view of the future. I think it's quite a good metaphor there. Knowing the difference between right and wrong. You know, these are the things that we instill into children from a very early age. But if they've not had those secure attachments, they may not be able to know the difference between right and wrong. Because to know the difference between right and wrong, you have to give that to a child. Agitated, on edge, obviously, that's a quite good indicator for a lot of things. This could be other areas of mental health. This could be linked to anxiety, as I've talked about in one of the other workshops. It could be linked to stress, could be linked to depression. But again, these are things we want to be investigating if we get children like that. Transience, being a little bit not really taking things in. Fidgety, again, not to be confused with fine motor hyperactivity, but constantly fidgeting and fiddling and with things. Overexcitability. So we got children that get just revved up from 0 to 60 in absolutely no time whatsoever. And actually go, well, I don't really understand where that came from. Overreactive aggression and inappropriate sexual behaviours. Inappropriate sexual behaviours. This obviously with access to the internet, people are getting more and more exposed to this kind of sexual activity. But obviously, you know, when a child is presenting with inappropriate sexual behaviours, it's got to have come from somewhere, and again, you know, that often is as a result of neglect and an insecure attachment. Okay. Other areas of sense of self, they may be verbally abusive, and we do get this in early years settings. Lack of self-awareness and the inability to describe feelings. This is tricky again. Obviously, you know, many of your young people that you'll be working with will be pre-verbal, so they're going to be unable to describe their feelings anyway. But also the fact that that those that are verbal are unable to describe their feelings as well. This is obviously something that you're going to have to work on, and that's where you get your role playing and your modeling and your puppets and things like that. We will be doing that to help them to express and describe their feelings. Effects of insecure attachment, some other things here. Trusting others, that they just, you know, we have to, as humans, we have to a certain extent, trust other people, and most people will do this in various areas of life. And this is something where people who have insecure attachment will have struggled with that, and they won't be able to trust others, unable to sustain their friendships and their relationships with their pals in school, making and keeping friends. So not just sustaining them, but actually creating those friendships in the first place, because they don't know how, because of this insecure attachment that they've got. Understanding other people's feelings. So looking at, you know, understanding facial expressions, or understanding the fact that somebody has lost something, had something taken, that you know, not understanding how that person feels, that inability to empathize. Social communication, knowing how to communicate in a correct social manner to meet the needs of the listener, and to also to be able to put themselves across as rational people. Over familiarity. I mean, again, this is a tricky one when we're in an early years setting, because in an early years setting, those quite often children can be very loving and very over familiar. But I think as professionals, we know when something is a little bit not quite right, and those are the things that we would be looking out for. And so it's again having that judgment yourself to say, that child's being a little bit over familiar, and I'm just going to flag that up. If nothing else, speak to your line manager, flag it up, evidence everything. Trusting adults, you may well be trusting them too much, or not trusting anyone at all. Heightened sense of justice. This has happened. You need to deal with this. You need to, and this person has taken this one Lego cube and they've taken it away, and I want you to have them beaten. It's that kind of heightened sense of justice, and then sensitivity to respect, because we have this low self-esteem, and that low self-esteem causes us to require more respect, and a heightened sensitivity to respect as well as justice. Okay. Within those relationship skills, we might find there's a lot of lying, and so making things up. Physical eye contact, so difficulties with eye contact is quite a common one, and difficulties with physical contact is quite a common one. Now I'm gonna come more into that, because just bringing up those two things about eye contact, physical contact, we're getting into other territories there, and I'm sure you're thinking that yourself as you're watching this. Inability to explain their actions, and again, that's something else that I really want to go digging into a little bit later. So very superficial in relationships. These children that may on the surface feel very, very friendly, but when you dig that little bit deeper, there's not much there. Lack of remorse, clingy, lacking expression, and finding it difficult to let themselves go, let themselves have fun. This is the result of some quite serious emotional damage here, and obviously when you've got all these things happening at once, they're going to be flagging up to you anyway. Okay, insecure attachment in school or early years settings. Some of the things that will bother them will be changes to routines. Everybody's looking for their comfort zone in some way or another, and we know that routines are crucial for young people in school and early years settings. And what's interesting about that is we try to sort of give that freedom to them to do what they want to do, but also within that, we like to keep a routine in that as well. And that routine, so many young people crave that. Organisation problems will be an obvious one, because you haven't learned those skills early on. Difficulty concentrating, many mental health, stress, anxiety conditions will present with concentration problems. But again, we're getting into other areas there which I'd like to be talking about in a little bit. Progression problems, moving on to that next stage, and we do have that kind of that baby thing going on as well, where young people will feel that if they pretend to be more or behave in a more baby way, then they'll get better attention from the adults around them. Speech and language difficulties, I've gone into that in a little way. Speech and language difficulties is quite common in these, because nobody's spoken to them, nobody's given them their needs in their speech and language, or there's that back to that iPad babysitting situation. Difficulties with fine and gross motor skills, and inconsistent responses to rewards and sanctions. I'm a big fan of rewards and sanctions, but what I would say is that rewards, and I'm really big on rewards, must outweigh sanctions, but that those rewards that you give a reward to somebody, they appreciate that reward, they take that reward to themselves and they go, that's fantastic, thank you very much, I really enjoy it, because that's the thing that you've negotiated with them. With these children, they don't want to give that to you. They don't have that ability to give that to you. So you can give them something incredible and they go, yeah, thanks, whatever. And it's that, they will not engage with that. And this is very evident in very, very young children, that you see that and you go, what is it about that child? I thought that child really enjoyed that thing. I thought they really liked engaging with that particular toy or whatever it might be. So what are we going to do? Right, we need to work really closely with these children. We really need to have our to be looking out for all the triggers, all the indicators, all the things that aren't working out, and we need to action plan around those things really, really closely. You have to remember that that these children may get stuck at certain development stages because of their early experiences. So like I was talking about, being baby, or they may get to a point where they may just choose to crawl or something like that. And so we really sort of, or the requirements of you may be, if they're at a point where they can pour a drink, they won't do that, and they might ask you to do that for them. And these children seriously need a developmental boost, and that's our job to do that. And again, it's through looking at the triggers, looking at the indicators, looking at the evidence right in front of us. Remember, you probably spend more time with these children than their parents. You are probably the biggest influence on their life, and so you need to remember that, so that you can put things in place for those children. Now, okay, relationships, child development. Humans are a social animal, and as a social animal, we need the influences of around us. So the development that we have is intended to be negotiated within the context of the relationship. Now, to my way of thinking, there are three areas of relationship, or originations of relationships, and these are the community in which you live, school and early years settings, and the home. Now, any one of those could be the not in place for those young people. Indeed, you could argue that all three of those could not be in place. Let's assume that school and the early years setting, or school and or the early years setting, is in place, and we're doing the things that we need for that child. Let's just assume that for the moment, okay? But that's fine. But then we've got home life is not very good, and maybe they're living in a community which has its own difficulties. And so what you've got to do there, we have to have a holistic approach on this. So what can we do within the home? What kind of connections can we make with home? What kind of help, advice, support can we give to families in home in order to get the home and the early years setting? What can communicating with each other? What can the setting do within the community? Certainly, we have lots and lots of schools who've set themselves up as kind of mini community centres, inviting people in and working with people. I remember I used to work at a school where they were doing stuff every night for families on the estate where the school was. So this is in the days before Wi-Fi being everywhere. The head teacher of this school managed to get Wi-Fi for the whole estate. He had computer classes being run in the school. He had fitness classes being run in the school. He had multiple after-school events for families, communities, and of course the children that went to the school. These are things that can be done. But what we do also have to accept is, if perhaps at school and the early years setting that we're the only bit that's got something in place for those children, then we just got to accept that. And we've got to just work doubly or triply, in this case, hard to help those children get to where they need to be. And we do have young people who come out of the system saying, you know, I couldn't have done it without the support of my teachers or my schools or what have you. So very important to remember this. And so that what we're saying really, the schools, the earliest settings have a massive vital role to play. And as I said to you earlier, what you've got to remember is the children are there a long time. Yeah, and you are probably the person that sees them more than anyone else. You know, if they go home at 3, 4 o'clock and they have a little nap, then they have their tea and they're in bed by 7 o'clock. You know, really, you know, what are the parents seeing of them? We have a vital role to play in those schools and early years settings. We make progression plans for children. And those progression plans are quite often next stage academic, physical growth type things. What we need to do with these children, part of your differentiation or how you work with these children, is we need to reflect the social and emotional frameworks. Where are we wanting them to get to next, socially and emotionally? We can have just as much success in teaching a child to say please or thank you and understanding what that means as we can with any physical milestone or with any academic milestone. So these are really important things to be bearing in mind. We also need to think about what we're asking the child to do. This seems to be something that comes up in my work an awful lot of the time. So rather like children who suffer from stress or heightened anxiety, we want to be able to say to these children, here is a task, here is something I want you to be able to do, or here is an ability that I want you to have. This could be a social ability, emotional ability, academic ability, or physical ability. It really doesn't matter, but this is something that I want you to have. And but when we're doing that, we have to think, are they able to do that? And we're looking at small steps. One of my kind of mantras is almost, if you can call it that, is never settle for less than a little bit better. You know, when people say never settle for less than perfect, I want to say never settle for less than a little bit better, because ultimately these kids have experienced trauma or loss, and we're having to build around that to help those children progress. Okay, so like anything else, we need to adapt our practice. Now, we need to adapt our practice in every situation. With every child that we work with, we need to adapt our practice. But here's the thing. In my experience, so many professionals do not. And what's going to happen is here, that if you cannot just do what you normally do in order to meet the needs of these children. No, you can't. What you have to do is look at the individual needs of each child and build a plan around that. Our practice needs to be built around that. And in particular, children with attachment difficulties and those complex needs, we really need to be working around that in a slightly different way. And you know yourself that there are children there that you can pile anything on top of them and they'll come out smelling of roses. These children may not be like that. And so you have to think differently. It's my virtual coffee morning going on. So if you are an educator in that kind of setting, you need really two main tasks. Number one, providing the optimum learning environment. Learning environment isn't just a physical building, but it's the ethos of that environment and how you think and how you speak to those young people. And we need to engage those children in the learning, get them interested. You know, there's and again, you know, in the early years setting, you're constantly looking out for special interests with those kids. Right. Few things, some do's and don'ts to remember for you. you need to use supportive scaffolding in your interventions. You need to differentiate your communication, not on their age, but on their emotional development age. And I am very, very aware that, that, you in your early years settings, you can tell those children that have been given that verbal input and that conversational input, you can spot those ones, and you need to differentiate at that in much the same way as it was always my belief that when I taught in Key Stage 1, it's a little while ago now, but when I taught in Key Stage 1, I could just about tell which children had been to a nursery or a preschool, and I could tell because of the input that they've had. Because they do come out with some amazing experiences, but you do have to work that out and say, what are they ready for? What are they capable of? View behavior as communication. Anyone who knows me will know that all behavior is communication. So if they're aggressive, are they telling you that they're in aggressive situations at home? If they are displaying inappropriate behaviors, is this something because they're witnessing somewhere else, or is it because they're suffering some kind of trauma? Are they asking you for a little bit of love? The child that needs the most love will ask for it in the most unloving ways. Please don't differentiate by outcome. We have to build a core of differentiation. It's not about seeing how they get on. It's about building a core of differentiation and letting those children have a foundation that they can grow out of. And so really, again, worth developing that. Get to know the child. Get to know their likes, their dislikes, what makes them tick, and be explicit in your communication. One of the least helpful things is implicit communication. Implicit communication basically means that you are expecting them to work stuff out for themselves. Be really clear in what your expectations are, because then they know what they want and they are comfortable in trying to attain that with you. Easy stuff for them. Okay. So your tasks shouldn't be too difficult, but your tasks need to be, and your expectations need to be, matched to the development of that child. And so we've discussed that about communication as well as any tasks that you've got in their place. They need to be challenging. We're there to stimulate their little brains and their bodies, to get them doing things that they've maybe not done before. But we also have to remember that those things need to be achievable. And that's where we're back to that, never settle for less than a little bit better. And you've got to get that balance really between challenging and achievable. If it's too difficult, then it's challenging and unachievable. If it's too easy, it's achievable, but hey, who cares? So that's some stuff we really need to be thinking about. Now, back to the beginning again. When babies are born, they rely on parents or their caregivers to protect them, care for them, look after their emotional, look after their physical needs. Let's face it, babies aren't very good at lots of stuff. So we're there, the parents, the caregivers are there to help them with their emotional and physical needs. We know that. But right, what happens? When we meet these needs, the children form a bond with their parents, they attach. Now, forming this attachment that helps them to learn to love, trust, regulate emotions, be aware of other people's feelings, and develop healthy bonds in the future. And this is what we talked about, adequate or more than adequate caregiving. This is the basic stuff. This is what they need, and they need to feel safe in that setting. But what we have if the bond is not formed is children can develop attachment issues. And one of those attachment issues we call attachment disorder. And it may be that the child felt isolated or abandoned or uncared for during their early years. The image on the screen there you can see is from the book The Little Prince by Antoine Saint-Exupéry. It's supposed to be a children's book, Personally, I feel it's more for adults, and it's about a child on his own and how he engages with different adults through different parts of the book. But what you find about this child is he's very detracted from and disconnected from the adults in the book, and he asks rather odd questions and unusual things. I'd urge you to have a little read of that book, because I think that's a really good example of the abandoned, the isolated child with attachment difficulties. The reasons behind experiences can be complex, but for a young child, all they understand is that they cannot depend on others. Have a look at that picture. Now, if the person on the bottom was the child, by the way, I'd just like to credit Pip Wilson, The Blob Tree. This is an extract from her book, The Blob Tree. Fantastic book. Buy the book. It really is one of my absolute favourites. Pip Wilson, The Blob Tree. We've got here the child. If that's the child at the bottom being dropped, and if that's the parent at the top or the caregiver dropping the child, are we saying that that parent, that caregiver was at fault? Possibly, possibly not. What we're really saying is, what I'm trying to put across to you is that sometimes these experiences are not in the control of those people who were the parent or the caregiver at the time, and things happen, bad things happen, but all the child sees is, you let me down. That's what the child sees. And of course, it may not always be the case, but that's what the child is seeing, and that's kind of how it becomes that little bit complex. The lack of attachment can lead to behavioural difficulties. It may affect relationships. It may affect social bonds. We know this because of, we're basically dealing with the psychological context of nurture here, and that concept that children will behave in a way that they mimic from what they've seen at home, and so their lack of attachment to them leads to a lack of attachment with others, and so it goes on. And then quite often the behavioural issues that go alongside that are also ways to mask the fact that they have these insecure attachments, and they don't quite know how to deal with them. Okay, what I would suggest is, we're about halfway through here. This is a longer session. If you want to take a break here, this is a good time to do that. If we take a pause and get yourself a cup of coffee, come back and join me. Okay, welcome back. What is attachment disorder? Attachment disorder is a specific disorder of mood or behaviour, the inability to form social relations due to a failure to form attachments at a young age. Typically it affects young children. Left untreated, it can apply to school-age children and adults. I'm going to take this one line at a time. It is a disorder of mood and behaviour, but it's worth knowing that unlike autism and ADHD and things like that, it is an acquired disorder of mood and behaviour. And so that is worth knowing, and it is acquired through trauma and loss. The inability to form social relationships due to a failure to form attachments at a young age. The most common failure would be not having the input in which to do that, in which to work around that. It typically affects young children. We're talking preschool children, but if you leave it, it can apply to school-age children. And I'm going to say to you, adults, I added that because actually I am aware of adults who have attachment issues, and they've actually acquired those attachment issues in later life, which is kind of interesting because we don't see too much written about that. And so what I've got there, we have a child with emotional and physical needs. The needs are not met. They may grow up into a non-trusting and detached adult. Now, with attachment disorder, we actually don't have good figures as to who has attachment disorder. And now, the reason we don't have those figures is quite often many families who have those issues in the home do not seek the help that they may need. Now, the reason they probably don't seek the help that they need is because you know, they may be vulnerable families who don't feel that there is a problem, or there may be a vulnerable family that doesn't want the authorities poking about, that lack of trust. Remember, we said it goes down the line, a lack of trust in parents goes to a lack of trust in the child. And so we really are very unsure about how many families really do have these conditions. But it is something in as much as that those families don't necessarily seek the help. Now, if those families are not seeking the help, this again leaves you as the one to be relied upon, as the professional, to be looking into that, and how can you be helping that family. That's where our responsibility to the whole child comes into play. It is interesting, from my teaching days, I do remember flagging up difficulties to parents who would respond, "Well, I was like that. What's your problem?" And that did happen. But in the same sort of setting, I also had parents that I would share that information with, and they were delighted to get that information from me, and were willing to make change. So not everybody's the same. Social difficulties. The failure to form attachments in childhood causes social difficulties in the future. But you know what? This is not insurmountable. With all the right interventions, with all the right social help, we can do things to help those children. These children may find it hard to understand others, may be wary of others' attempts to socialise. And so, but we can teach this stuff. This is basic, social skills training in the school. But what we do have to be, we have to be consistent ourselves. We have to prove ourselves to be trustworthy, and we have to prove ourselves to be reliable. Social anxiety, also, I've covered that in another workshop and another EYFS workshop. But that social anxiety, finding it difficult to speak to others, that will come up. But again, that's stuff we can work on. We can work on really closely with those young people for that. Like many conditions, attachment issues fall on a spectrum. Mild problems can be easily addressed. You might just have issues of using basic manners or things like that. There's a more serious type of attachment disorder, which is called reactive attachment disorders, and the symptoms really may vary in severity from person to person, and so it really does fall on a spectrum. And this is the bit that I'm aiming at as we've been going along, may resemble other conditions such as autism or ADHD. So I'd like to talk about the ADHD and the autism. So we talked about, let's just start with ADHD. ADHD, earlier on we talked about the fact that attachment disorder can lead to children not knowing why they've perpetrated certain acts, why they've done something. You say to a child, "What did you do that for?" They go, "I don't know." Well, that's very similar to impulsive behaviours in ADHD, where we say to a child with ADHD, "Why did you do that?" "I don't know." And the reason they didn't know is because they reacted in that way due to impulsive behaviours, which is intrinsic to ADHD. We also talked about the fact that they're very fidgety and things like that. Again, fine motor hyperactivity, very much part of ADHD. We talked about the fact that that lack of trust, that lack of social understanding, that lack of empathy with others, and all of a sudden we're building a massive autism profile. And so we've got to question these things, and we've got to say, well, look, if we know all this stuff, and we say we can't detach autism and ADHD from attachment disorder, what do we do? Well, I would suggest to you that one of the things you need to do is to look at the child and start with the child. So what you're doing there is you're saying, I see this activity, I see this behavior, and what I'm going to do now is I'm going to work with that activity, work with that behavior, not work with whatever level or whatever condition or whatever diagnosis or what I'm expecting to see, but what I actually see. And not just with the child, what's going on behind the child, what's going on at home, in the community, and we can work around that. That would be my advice. In so many occasions, I see things where I maybe don't necessarily agree with the diagnosis, and yet what we do have is, we've still got a child with problems. And I think what you have to do is you have to go in and you look at what you see and you work with what you see. So that would be my advice when you have those those sort of dichotomous situations where you're not sure what it is you're dealing with. Serious attachment issues often follow neglect or abuse. The two types of reactive attachment disorder is the inhibited and the disinhibited. Reactive attachment disorder is, the inhibited one, that they don't really like to be out there and socializing, and the disinhibited one, that'll give anyone a hug, and irrespective of whether that's safe for themselves. So the inhibited attachment disorder, the child you would expect to see extremely withdrawn or emotionally withdrawn. Those people, they really don't want you in their world. And that was when I was talking about reward systems, and they'll give you a reward system. You give them a reward system that they like, and they're like, no, I'm not thanking you. You're not getting in. I'm not letting you into my world. Resistant to comforting and hypervigilant of their surroundings. Now, hypervigilant of their surroundings, I see this a lot. It's very easy to spot. Children, I saw a young person recently with this. As they're coming into rooms, they're looking around and they're trying to see what's there, or they won't. Someone will be completely reasonable with them and say, hello, how are you? And they look at them like, what are you doing? Why are you being like that with me? Who said you could talk to me? All that kind of thing. The disinhibited, likely to seek comfort from anyone. It doesn't care who it is, not preparing parents to strangers, often very dependent and often act younger than they really are. That's a disinhibited attachment disorder. And again, this can lead, as if we don't address this with our social skills and our social skills training, then we're gonna have problems in later life with those kids, because they're making themselves vulnerable. So, how do we treat attachment disorder? What interventions can we put in place? Well, there's two aims. Number one, you have to ensure a safe environment, which is particularly when there's been abuse, neglect. I would also say crime involved in that. That's something. And that safe environment has to be psychologically safe as well. They have to know there's an ethos of safety and there's an ethos of trust here. We also have to help the child form a healthy bond with the appropriate caregivers and deal with any problems that are outside there. And actually, I would also say to you, as professionals, it is okay for you to develop healthy bonds with those children yourself. That's completely okay. That would be completely acceptable. These children crave attachments, and if you can make a positive attachment with that child, that is completely appropriate as far as I'm concerned. In fact, it's one of the things that I recommend. Some of the things we can do, we talked about earlier, we worked on the family therapy, is to get the whole family round and say, how can we help? What can we do? Here's some of the advice we need. Here's some of the advice we're going to give to you. Here's some training you can go on. Play therapy, working with you know, the child. We've got all sorts of great things out there. There's Lego therapy at the moment, seems to be extremely popular. I've done some work with Lego therapy. I was very, very impressed with its effectiveness. And I've worked with Lego therapy with children, and I've even worked with Lego therapy with groups of adults, professionals. I did it with a group of school teachers in a primary school, and it had massive, fantastic results. And then, of course, the individual therapy, to let that child express themselves to a trusted therapist in a scenario, in a situation where they know they can let things out, and that they can trust and be understood and trusted. Be realistic with your expectations. I talk about this a lot again. You know, we're not looking to change the whole child. What we are looking to do is to give them 2 or 3 things at a time that we want them working on. So, you know, you might decide that it's not really the time to be worrying too much about learning to tie your laces at the moment. We've got far more important things to do for that child. So let's stick with Velcro for a little while until, you know, these things will come later on. Again, you know, it's about thinking through what's important for the child, what's going to get them to where they need to be in the short term, and also what's going to not put them under too much pressure as a target, as a forward moving goal. We've got emotionally sorry about that. We've got emotionally volatile children here, and so, you know, what you need to be doing is, if they've achieved something, really well done, really push that out there, really work with them. One of the phrases I used in one of the other workshops is, your face needs to hurt from smiling. You've got to be with that the whole time. Celebrate any signs of success, even the very small things, because you don't know how much that means to that child. Be patient, particularly when things go backwards. Sometimes, you know, they will achieve something on the one day and they won't be able to achieve it on the second day. That just happens like that. Although I will say, and it's worth looking at, I am going to be running a fetal alcohol spectrum disorder workshop. I will say to you, if things go backwards too many times, I would be looking at different things. And the reason I mention fetal alcohol spectrum disorder is sometimes the fetal alcohol spectrum disorder brain has the inability to retain learning, and it loses it again. This is because fetal alcohol spectrum disorder is very different to attachment disorder. Fetal alcohol spectrum disorder is a traumatized brain, it's brain damage. So, you know, you've got to be really keeping your eye on the ball with all this. Be patient, keep calm. That will help create an atmosphere of safety and security. Don't get involved in the custard pie fight, is what I'm trying to say here. That, you know, things happen, and somebody's got to be the grown-up here, and it's going to be you. And so, you know, what you're trying to do is create an atmosphere of safety and security that these children really do crave. And I know it's hard work. And you know, sometimes, especially if they're the disinhibited type of attachment disorder, they will be pushing all of your buttons, you know, and so you really do need to be calm. And in actual fact, what we're then looking at is the fact that attachment disorder leads to attention needing, and that attention needing may lead to the wrong kind of attention needing. So you really do have to have your wits about you when it comes to being calm. We have to remember that children with attachment disorder experience massive stress, you know, high levels of stress. So your job is to bring the stress down. Doesn't matter how stressed you are, nobody needs to know. You can sort that one over your coffee in the staff room, but communicate with your colleagues. If you're having any successes with that child and you want to share information, and you want, you know, you need to share that information anyway. You want everyone else to know what works with that child. And again, staying positive is very helpful. If they sense you're feeling discouraged, they're likely to feel discouraged as well. And so, you know, it really is, you know, you've got to be back with that, with that face that hurts from smiling. But don't be afraid to set limits and boundaries. Limits and boundaries are good things. That's how children learn. That's how they manage to they manage to work out how you know, the social expectations of life. Okay, so I want to talk a little bit more about limits and boundaries. Okay. Boundaries, if they're consistent and they're fair, boundaries make the world more predictable and less scary. So what we do when we set limits and rules on young people, what we're actually doing is we're letting them understand what's expected of them. And if you have fair consequences, that is helping them to understand that, you know, that they're in control of their situation. And actually the other thing that you need to do is if you've done something wrong, something outside of the parameters of what you feel they should be, tell them, oh, silly me, I shouldn't have done that, very sorry, you know, because again, it helps them to trust the adults in their world. Remember to use visuals in your setting. Visual communication is hugely important. You know, I sometimes I do wonder. I go into environments. I've seen signs in early year settings that read no more than 3 children in the tent at one time. They can't read, you know, and so it does make me wonder sometimes. But you know, use your visuals. Have pictures up of what you've expected. Most people are visual learners. Most children are very much more visual learners than adults. Your visuals get through 60,000 times faster than text. How do they work that out? I've always wondered that. But yeah, using your visuals in your environment, very, very helpful. Visual communication, right down to visual timetables about what you need to do to go in the garden, which shoes you need to put on in certain environments, when you need to wear your slippers, all those sorts of things, about washing your hands before and after you've had your sandwiches. Remember the power of modelling. Yeah, if you want a child to do something, you do it yourself. Be creative with communication. Don't just rely on your voice. And we're back to visuals then. Visuals, the most powerful way of communicating to any children, but also children that you're trying to teach social rules and social interactions to. The emoji, fantastic. I talk about this all the time. If you go onto my TEDx, I talk about it in there. But the emoji is a fantastic, really, really great way of teaching children emotions and social expectations and your social responses to things. These are Bitmojis. You can make these yourself. They're really, really good, and they're very good fun. You can get them. You can make these on your phone, is how you do it, or you can make them on a tablet. They're called Bitmoji, and they are they're in on Android phones. They're just called Bitmoji. In Apple phones, I think you have to go into Snapchat, and it's a thing within there. So we're not expecting the kids to make them, but you can make this up. So this one here, I've done this one. It's supposed to be me. So it's me in a suit and a red tie and kind of floppy hair that I had at the time. You can make that up as anyone. You can make that a person in their shorts and all the rest of it. And we can talk about what happened to the man. What happened to the man? The man stood on the rake. The rake slapped him in the face. How does the man feel? The man feels sad. The man feels pain because the rake's hit him in the head. And what would we do to help him? We might go and ask him if he's okay. And you can do so much really good work with that. This is another one. And you know, this might be a bit complex for little ones. They may not know who Superman is, but there's so many things on there you can do. So this one is the man's on his way. He's going to help somebody. How does the person who he's going to help feel? You know, why is he showing his chest like that? He's strong, you know, and all that kind of stuff. So really interesting. And then there's another one here, which I've put in for the people amongst you who work in schools. This is what it feels like going back to work on September the 3rd every year. Okay, so maybe that one's not really for the children. I've put that in for you, but you know, going back to that that first one, you know, there's loads like that you can be doing, loads and loads of interesting work with that. So something to be thinking about. Use your visual timetables. Visual timetables, hugely important. Visual timetables, try to keep them as contextual as possible. Try to keep the images in there, you know, rather than using sort of the writing with symbols type thing and the widget sort of stuff. I would say I would be more interested in using photographs. So some of these are photos, some of these are widget. I would use photographs. So if it's lunchtime, if it's sandwich time, you want a picture of a plate of sandwiches with the children that you are working with sitting around those sandwiches. So that would be something that I would use. We need to look at facilitating supportive scaffolding. One of the best ways you can do that is through using special interests. When I'm talking about special interests, it's, you know, that's the way you capture a child. And particularly for an emotionally upset child, if you're looking at special interests, that could be their comfort zone. That could be the thing that they care about most. So build on that, matching tasks. So if you've got a child that loves trains, we want to be talking about trains. If you've got a child that loves Lego, we want to be talking about Lego. You know, it's really that simple. And by just doing it, that little thing, you're going straight into their comfort zone and building around their needs in a far more effective way. How do you find out about their special needs? This is quite a special one that I've done, and I did this some while ago. This is an All About Me shoebox. If you send a shoebox home, they can put 2 or 3 of their favourite things in, put some photos in. Clearly, this child here is a preschooler and is very keen on the Beatles and books and running and swimming. No, of course not. That one's mine. But, you know, you can do this with anybody, and it's a really lovely family activity, and it's a really lovely sharing activity, and it's a really lovely show and tell activity that you can integrate into the day in your setting, and you'll find out so much. Remember that activities, things that you ask a child to do might take more than you expect. You know, how often do we say to a very little child, we ask them to do something and they do it wrong, and you think, well, why did they get that wrong? Surely that was the easiest thing in the world. Well, actually, maybe it wasn't, because maybe it was something that took lots and lots of stages before you achieved it. And if you get things wrong too many times, we end up with the person there, I'm not doing it. And the I'm not doing it person, that's fear, that's lack of self-esteem, and that's basically every child, you know, with attachment disorder, really, isn't it? We need to support the differentiation between relationships, that, you know, you can speak to different people in different ways, and there is, you know, sadly life does have a pecking order, and you know, how many times have we heard in the nursery, is that any way to speak to our visitor? So, you know, we need to do that. We need to translate social situations. We need to support when it's all right to talk. Who and when to tell personal things to. This is hard stuff for little ones, but we can do it. We need to help them connect in ways which are healthy, safe and appropriate. And then one of the ways you can do this is by thinking aloud. Oh, I wonder what I'm going to do now. Wonder what I should do in this situation. Tell me, Matthew, what would you do in that situation? That thinking aloud thing, really, really powerful stuff. Be explicit about what's happening, why, especially if voices are raised. You can explain situations. Children are pretty good. The thing is to make them feel safe. Break your expectations into chunks. Be cautious of making assumptions about a child's understanding. They may not get it. They may get it more than you expect. Help them organise their thoughts. And again, we can get that through asking the right questions, through role playing, and through other kinds of activities like that. And also, if they're doing something extra, we need to support them in that. If they're going to do something, children often start dance classes at a very young age, and obviously that can be quite a challenge for children, such as children with attachment disorder. And so we would want to help support that. Maybe be with them for the first half an hour or things like that, just until they become integrated into the routines. Help prepare them with equipment if they're doing little tasks. We're very good at that in the nursery, putting all the stuff out. But are we good at telling them what the stuff does? Do we assume they know how a pair of scissors works? Remember the power of modelling. Remember to use your voice, but also with your visuals. Visuals hugely important. Check understanding and comprehension, and set really good examples yourself. You are the role model. Be ready and prepared. Sometimes, there's things that they have to do, and they may well need a bit of support to avoid failure, or they may well need a bit of support as a result of a failure. That's fine, as long as you're ready. Have a plan. Always be ready to be part of the plan. When they've completed something, let them see your pleasure. When you've completed something, let them see your pleasure. Let them know what success looks like. If you've done something that you think that's great, and you can ham it up a bit, do show them. If you're building something, you're making something with the children, you've done it, go, hey, look at me, I did this amazing thing. And then they learn that it's okay to show that kind of pleasure and success. Your differentiation is not just about the tasks you set them, it's also about your differentiate how you relate to this child as opposed to you relate to that child, the words, the language you use, and their emotional, social tasks and targets. We've covered this. It's hugely important. It's equally as important as their academic tasks and targets. And remembering that their behaviour is communication, as I've said, that most of those behaviours, they are communicating the fact that they are fueled by their anxiety, which is related to their condition. And we need to focus on the causes of these behaviours. Why they're doing it, not what they've done. Traditional rewards and sanctions may not work. It's better to spend a bit of time working with that child and getting to know what works for them. That's the most important thing that you can do. Some of the words we need to do, don't be too implicit. So it's not helpful to say, be kind, calm down. Tell you what, I'll set you a little challenge. When your partner, if you have a partner, is in a bad mood next, tell them to calm down and see what the response is. We know it doesn't work. You need to be really, really clear what you mean. So calm down, it might be, come and sit with me, tell me what your problem is. We need to be really, really explicit. And I think sometimes we're not explicit enough. So one of the, being kind, touch others gently. They feel uncomfortable when you push them or when they're pushed. Please talk quietly to others. It shocks and hurts people when you shout in their ears. If you see someone on their own, ask if you'd like to join, if they would like you to join them. People can feel sad if they're ignored and moved away from. Smiling at people can make them feel happy. People can feel upset and confused if they are snarled at. And that's the kind of thing that we're doing. So what we're really doing here, we're talking about, this is the metaphor. We have to be really, really gentle with these children. So I want you to think about attachments, and I want to think about attachment disorder in particular, or children that present with attachment disorder. And what I would really like you to do is, as your directed task, I would like you to come up with an action plan. It doesn't have to be a child you know. You can make it up, or it could be someone you know. An action plan about how you could think of maybe 3 interventions that you could help that child with, but how you would find out about them too. So how are you going to find out about the child, and 3 interventions that you're going to put in place to help them along their way. You can share those by email with me or by any other way, andrew@peoplefirsteducation.com. You can work on them with your teams. I really don't mind, but I'd like you to think about it. So thank you very much for listening today, and look forward to seeing you on the next workshop.